There is something that still shocks physicians when I say it out loud. Most doctors are leaving tens of thousands of dollars on the table every single year, not because they're not working hard enough, but because they don't understand how to document the work they already do. And no, this is not about gaming the system. This is about accurately reflecting the care you give, so you're finally compensated for the value you provide. Number one, the first rule: stop practicing like a 1990s doctor. Most physicians are still documenting like the old days. And if reimbursement is magically connected to how much you write instead of what you actually do. Billing today is about complexity, medical decision-making, and preventive care. If you don't know how to capture that correctly, you're working twice as hard for half the pay. 2. The second rule: the visit you think is simple almost never is. Doctors say, oh, it was just a quick hypertension visit. But was it? Did you review labs, adjust medications, address side effects? Reviewed risk factors, talk about comorbidities? Congratulations, that's a complexity. But unless you document, the system treats it like a drive-through blood pressure check. You're doing the work, you just aren't getting paid for it. The third rule: preventive care is your biggest missed opportunity. Annual exams, annual wellness visits, screening updates, risk assessments. Most physicians don't realize these are separate high-value services, and when combined correctly and ethically, they boost their patient outcomes and physicians' income. I'm telling you right now, preventive visits alone can transform your revenue without adding a single extra patient, and saves lives too. Fourth rule: thorough documentation is not extra work, it's income. When you document accurately and thoroughly, your coding becomes correct, your reimbursement aligns with your effort, and you stop giving away free labor on every chart. I used to think not prep was a homework. Now I know it's one of the most profitable, protective habits in my entire practice. Fifth rule: burnout doesn't come from seeing patients, it comes from underbilling your genius. When you practice medicine with your whole brain and whole heart, but get paid like you only treated one tiny piece of the patient, of course you're burnout. When I finally learned how to capture the full value of my work, I reduced my clinic days, improved my income, and became a better doctor for my patients, because I wasn't rushing anymore. So my final message to you is, most doctors think the only way to earn more is to see more patients. That's absolutely false. The real path is see fewer patients, do better work, document accurately, and get paid fairly. Your revenue increases when your care does, not when your exhaustion does. If you're listening to this and thinking, why did no one teach us this in residency? That's exactly why I created my course. Because physicians deserve to work less, earn more, and practice medicine the way it was intended, with time, accuracy, and heart. If you want the deeper strategies, I'll teach everything step by step to you. I'm Dr. Gani, helping physicians rediscover joy, freedom, and the income they deserve.